Hello, and thank you for listening to my presentation. My name is Lisa Smith, and I am presenting clinical and administrative applications for the EHR. Healthcare is a rapidly evolving field, not just in medicine as a science, but in technology as a practice. In 2009, the American Recovery and Reinvestment Act was passed and included the introduction of the Health Information Technology for Economic and Clinical Health Act, which is also known as HITECH Act. And this increased incentives for covered entities to adopt health IT practices for the purpose of improving healthcare quality, safety, and efficiency. It is not enough to simply implement the EHR, however. Meaningful use objectives must be carried out as well through data capture and sharing, encouragement of patient engagement through a patient portal, and further support of the efficiency of quality patient outcomes. For change and innovation to be successful, organizations must emphasize the importance of implementation mechanisms. The EHR is defined by the National Alliance for Health Information Technology as an electronic record of health-related information on an individual that conforms to nationally recognized interoperability standards and that can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. The goal of the EHR is to streamline healthcare workflows and provide better, more improved quality of healthcare across the entire healthcare spectrum. Meaningful use objectives. Data capture and data sharing. The idea behind data capture and data sharing is to make transparency a standard across the entire organization to gain the trust of the consumer and to use the incentives acquired by the healthcare organization to maintain a perpetual cycle of continued data sharing. For the provider, this means eliciting more information from the patient to make better suggestions for course of care, resulting in more quality outcomes, thus increasing the quality of healthcare received and potentially reducing the cost of healthcare itself. Applications such as Apple Health and Samsung Health and other health applications that are accessible from a smartphone have taken the healthcare field by storm, and more consumers are able to access their information in real time just in the palm of their hands. Another meaningful use objective is patient engagement. With the growing evolution in health information technology, patients are able to engage in their own healthcare and make healthcare decisions through health information exchanges, such as a patient portal, where they can access, view, and download their visit summaries, laboratory results, and communicate directly with their provider in between appointments on any questions or concerns they have regarding their health. This has revolutionized the ability to make informed decisions concerning one's health, when before we had to wait to see our providers in person or go through great lengths just to get access to our records to share with another provider. The expansion of the EHR has opened up pathways to multiple providers being able to communicate with each other on the needs and concerns of mutual patients. Another meaningful use objective was patient outcomes. In 2015, the final ruling for participation in the EHR Incentives Program was released, requiring all eligible professionals to attest to implementing a certified EHR. This further enforced the first and second stages by enabling the coordination of care through patient engagement, the use of health information exchanges, and the added measure of public health reporting. The objective behind the implementation of the EHR into the participating provider and facility was to enhance and encourage the growth of interoperability among healthcare operations and ultimately provide higher quality healthcare resulting in higher quality outcomes. There are two parts to the EHR. The first is clinical applications. EHRs have multiple applications that enable them to operate in many different areas of the healthcare organization. These applications afford the ability of those using them to deliver the healthcare services necessary and include computerized provider order entry, electronic medication administration record, barcode medication administration, and a clinical documentation system, all of which are subject to the meaningful use measures previously discussed. The computer provider order entry is a tool to be used by a provider to enter orders for a patient while also allowing the ability for the order to be tracked, updated, and then completed once the medication is administered or discontinued. There is also an alert system attached to the CPOE for instances such as allergies or medication interactions, should the patient being given the medication have any such circumstances. The electronic medication administration record, simply put, is a medication documentation application used to view and document all medication use, whether it has been administered, previously administered and then discontinued, or the patient is actively taking the prescribed medication. The CPOE communicates with this system, which then communicates with the pharmacy what is needed for dispensing. The EMR keeps a record of how medications should be administered, such as frequency, route, and time of day. Barcode medication administration is used in combination with the CPOE and the EMR to safely and administer patient medications while also reducing the potential for medication errors. Like radio frequency identification, BCMA uses a scanner to ensure that 5 criteria are being met before administering the medication: right patient, right drug, right dose, right time, and right route. This process is accomplished by doing the following. The attending nurse scans their badge, then scans the patient wristband, and then scans the barcode on the medication. If there are any errors associated, such as the nurse not grabbing the right medication, or there being an allergy noted in the patient's chart that the nurse was unaware of, a notification would pop up and hopefully preventing the medication from being administered. Finally, the clinical documentation system. Clinical documentation systems are used to document summaries of encounters by providers with their patients and to create a treatment plan. Elements of a clinical documentation system might involve patient history and physical, or H&P, medications the patient is currently taking, the chief complaints of the patient, and a SOAP, or Subjective Objective Assessment and Plan section, in which they can document everything discussed during each encounter. A patient will always have the same medical record number, or MRN, but typically each encounter has a new account number associated with that MRN, and each visit can be documented in a separate encounter. The second part of an EHR is the administrative applications. In addition to clinical applications, EHRs also have administrative applications such as a financial practice management system, i.e. billing, supply chain and materials management, human resources, and business intelligence systems. These administrative applications enable the practice to control and track their expenditures, which is money going out, and their revenue, which is money coming in, as well as keep up with what they are needing and or lacking to appropriately care for their patient population in the most cost-effective way. The Financial Practice Management System. The idea behind a Financial Information System, or FIS, is to provide reporting tool for practices to keep track of a budget and make decisions that will impact the practice as a whole. Some components of the FIS include customer product purchases, vendors providing services, procedural supplies, and reimbursements paid to the healthcare provider or facility for services rendered. The FIS also includes a function responsible for payroll services for employees and or contractors working within the facility. Claims management can also be found with the FIS, as revenue coming into the practice via health insurance reimbursements and even patient accounts are kept in the FIS. Supply chain and materials management. Supply can be anything from acquisition of materials needed for proper care of the patient population to the placement of materials in various areas of the organization. A supply chain management system would include information about the vendors, service providers such as the cafeteria staff or the janitorial staff, and the customers. Supply chain includes pharmacy, medical and surgical departments, and all of the equipment necessary for operating the organization. Human resources. HR plays a pivotal role in the organization as they generally oversee operations such as recruitment of candidates selected from a resume pool, responsible for personnel within the organization regarding labor and pay, training and knowledge management, career development opportunities, administration of compensation packages and benefits for employees as well as retirees, evaluations of performance, organization management, and the health and safety of staff. In conclusion, the EHR is a complex and complicated operational tool, however, has many applications that benefit all areas of the organization in many ways. From the very first encounter with the patient to when the patient's interaction with the organization expires, whether by relocation or death, the EHR is used to document everything necessary for caring for the patient population of an organization. There are clinical functions as well as administrative functions, and all come together to form an elaborate and detailed picture of the operations within an organization. The EHR will continue to evolve and grow as more new and innovative technologies come about, and the key to implementation is knowing what functions of the EHR best suit your needs and how you can use them to provide the best quality care to render the best quality outcomes. Thank you for listening.